What should we do if we do feel like we're under too much stress or we've been finding things hard for a while? Sometimes people find that some form of psychological therapy or support can be really useful, and we usually call that talking therapy. So it means going to see a trained counsellor or a psychologist or a psychotherapist. And they'll usually have some helpful suggestions and ideas about how we might learn some new skills or try out some new strategies or make changes in our life that will make things better. Sometimes as well, when things are particularly difficult, it may be that some form of medication is helpful. So for example, if someone's been experiencing a lot of anxiety for a while, it can be helpful to take a medication that helps to bring that anxiety down, so they've got a chance to go and try out some of the strategies that might be helpful. Or if someone's been feeling low and depressed for a while, sometimes it's helpful to use a medication that improves that depression, to give the person a bit more energy to then go about their life and make changes that might make things better. And we can get medication that helps in that way, either from a GP, from a general practitioner, or from a specialist who's called a psychiatrist. Usually it's best to go to a GP first. How do talking therapies help us to feel better? Generally, by talking to someone about what's going on for us and what might be difficult, it helps to broaden our perspective, so we get more ideas about how to make things different, or maybe some solutions that we hadn't thought of before. What we know about medication is that it can be very clever in acting on our levels of neurochemicals that may be out of balance. Medication can also have an impact for people who may have a genetic vulnerability or genetic predisposition to some forms of mental illness.